And glad that you're still with us right here on the Morning Express. And now we are on what we call Lifestyle, the final part of this particular show today. And today on Lifestyle, we are looking at fibroids. And we thought it's important to do that because with a whopping 20 to 80% of women developing fibroids by the age of 50, although most of them manifest them between the age of 40 and 50, it is prudent for you as a woman to actually know what fibroids are, how they develop, some of the symptoms, and that's a conversation that we're going to be having right here on the Morning Express on Lifestyle. And remember, we're going to be opening up the phone lines for you not too long from now. The phone line will be displayed. In case you have any questions, we'll be letting you have that. But we'll start off with what we found out from the city when we went out asking about fibroids.
I've heard about fibroids a number of times, but the details concerning the disease, I don't understand it very well. I've heard it about being in women, and we should get to be entitled, and should also be taught about the disease, so the people in Kenya should get that knowledge.
Fibroids are growth in the uterus, basically. That's how I understand it. Yeah, a friend of mine, I learned the mom was sick with it. Yeah.
Fibroids are actually tumors which grow in the womb of a woman. Medically, it usually becomes very challenging unless the fibroids are first attended to before she can conceive. But in my previous experience with one or two fibroid-related cases, I found it very difficult for a lady to conceive when they have fibroids.
Of course, different aspects and views of what fibroids are. Also interesting there that quite a number of men seem to have an idea of what fibroids are. And the reason why I say that is interesting because we're going to be two men this morning talking about fibroids. And let me take this opportunity to welcome you, Dr. Edward Sang, who is a gynecologist. And you've been here before, and Karibu Sana, thank you for coming to just discuss this issue on fibroids.
Thank you for having me.
Okay, let's just start from the basics. What exactly are fibroids?
Fibroids are actually growths within the uterus, and the uterus is the organ which holds the baby during the pregnancy. So these they are very common growths, and are actually the common growths within the uterus, but also within the pelvis. In other words, if you combine the uterus, the ovaries, and the fallopian tubes, the fibroids are still the commonest growths you'll get anywhere in the pelvis.
Oh, so they're quite common.
Exactly. Yeah.
Okay. And what causes, the fibroids? What causes this growth?
It's not well understood. It's just known that usually they start off as one cell within the smooth muscle or within the uterus, and then just keep growing. And then it forms a round growth, which differs in size from one person to another, and also differs in number. Some people may have more, others will have less.
Okay. And just a quick reminder to our viewers that if you have a question, you can always call us. The phone lines are going to be displayed on your screen. You can also tweet at Michael G. Gitonga. That's at Michael G. Gitonga. And I'll be sure to ask the doctor to handle whatever concerns or whatever question that you may have. Now, why is it important for women especially, and I guess for all of us really, not just women, because they're part of, we are part of women in one way or the other in a family setup. Why is it important for us to know, about fibroids?
Well, fibroids do have complications. They cause ill health in women, and so the earlier we know about them, the better we can deal with them appropriately. Fortunately, many of them are asymptomatic, or they don't cause any symptoms. So some women may have fibroids but have no idea whatsoever.
That they have fibroids?
Yes.
Okay. And what are the symptoms for those who do have symptoms?
Yeah, generally the commonest symptom is actually bleeding. So a lady will start, her periods will start getting heavier and heavier, and usually also last longer and longer. So if she was having periods for 3 days in a month, they start going to 5 days and then 7 days, and then they get heavier. So she has to use more and more pads per day for the bleeding. So that's the commonest symptom, and of course it would cause anemia, because as she loses more and more blood, then she gets anemic.
Okay.
The other symptoms are not as common, but they can get pain. They can have a feeling of pressure in the pelvis. It may cause issues with the urine because the uterus with fibroids presses on the bladder. So a lady may find she has to go to the toilet to pass urine more frequently. So those are the main ones. Sometimes because of the location of the fibroid, they may have be attached to a cord, to the uterus with a cord, and that cord may twist. Sometimes again that can cause severe pain. In some ladies, the fibroid may be within the womb or within the uterus, and then it prolapses or comes out through the birth canal. So then she starts having a growth coming out through the birth canal.
Okay. Now you mentioned that one of the symptoms is heavy periods, and I'm sure there are probably other causes that could be linked to heavy periods, which may not necessarily be fibroids. Is there a distinct difference between when the periods are heavy, when it's fibroids, as opposed to other things? Is there a way you can differentiate and say this is actually fibroids, or it could just be a general?
Yeah. Usually what we would do is examine the lady, and if the uterus is enlarged, then we would probably think it's fibroids. There are, as you say correctly, that there are other causes of heavy bleeding. For example, she may have a problem with clotting, blood clotting. So the way if somebody gets cut and the bleeding doesn't stop for long, is the same way this lady may bleed for a longer time, yet she doesn't have fibroids. So if we would examine if the uterus is enlarged, that could be fibroids, and then we would also do an ultrasound, which usually would now determine or define exactly what is causing the heavy periods.
Okay. So once one has identified that maybe they have this heavy flow that is unusual, what should the next step be for them to prove that it's actually fibroids?
Oh yes, they need to be seen as soon as possible, and then we would now examine them, check the size of the uterus if it's enlarged, and then also do an ultrasound, and then make plans for treatment depending on the specific situation that she's in.
Sometimes medical care is very expensive, and you know, when you talk about ultrasounds and one having to visit a doctor, sometimes it sounds like it's a very technical kind of thing. Is this something that, you know, your local GP can identify? And secondly, are there some ways that you can actually tell, even before you go to the doctor, that, you know, chances are that these are fibroids?
Yeah, the local GP would definitely be able to diagnose that the lady has fibroids or not. The lady herself, it may be a bit difficult for the lady to know what. Yes, yes.
Okay.
So the GP would examine and then probably still send for an ultrasound. The reason why we have to do that is to really know what is causing the bleeding, because most of the treatment is actually surgical. We need to perform surgery, and so we need to perform surgery when we are 100% sure that we are dealing with fibroids and nothing else.
Okay. Now, according to this survey, 20 to 80% of women develop fibroids by the age of 50. And from what you defined it as, it is a growth. Two things here. One, is it something that grows out of nowhere, or is it a growth that is there, and maybe between that period of time, 20 to, well, while you're getting to the age of 50, it has now developed to that growth, or is it something that, you know, is out of just our normal lifestyle?
No, actually, it does start early on in a lady's life. Usually, rare before 20 years, but usually between 20 and 30 is when they would start to develop. So usually the lady would not have symptoms, but when she's now between 30, 40, and 40 to 50 is when now the symptoms of the fibroids would manifest. And so usually that is the time between 40 and 50, they start having heavier periods.
Okay.
It's interesting that also it's been found to be more in blacks than in whites, though the reason is not really well understood, but it's thought to be maybe the genetics, that probably the genes are involved in the development of fibroids.
Okay, there's a tweet here from Jennifer who says, I have a 12-year-old daughter who started having her menses, which I thought is a little bit early. They seem heavier than I would have imagined. Should I be worried about fibroids?
Usually it's very hard, to get them in a 12-year-old. 12 years is still a reasonable age for the menses to start, so I wouldn't be worried in her case. Usually, if she is concerned, an ultrasound can be done, but usually at this age it would be hard to really get a girl with fibroids.
Okay. What is the procedure of an ultrasound? Is it just that thing?
Yeah. Well, it uses sound, and it's a very simple test, usually done by somebody who's done a bit of training on ultrasound, and they would be able to tell, in this situation, the pelvic organs. How is the uterus? Is it enlarged? Does it have fibroids? How are the ovaries? Are they also enlarged? Are there cysts or growth in the ovary? Are the tubes okay? And so it can give quite a lot of information. If there are fibroids, it will tell us how many are they and where are they located, and then how big are they. So it's quite a useful test.
Okay. And you did mention that it's rare to have maybe a 12-year-old who would be having fibroids. Is it impossible for children to have fibroids?
No, not impossible. Even in childhood and infancy, they have been described, but extremely rare.
Okay.
So if a young girl does have heavy periods, once the periods start, or she's found to have a growth in the tummy, then we would also start suspecting that there might be a growth.
Okay, if they're below 12, or let's say maybe the age of 9, where they've started having their menses, what are the symptoms that one would look out for in a child, given that they may not even know what the issue is? They probably think it's a stomachache, and you know, maybe just touching the area of the stomach. What ways can a parent maybe check to ensure if it's a child that you know the risk of fibroids is not there?
They usually don't grow before the period start, because they have usually it's the estrogen, or a hormone which makes them grow, and usually that hormone starts being produced more after the periods have started. So before the period starts, it's very hard to get it. But if there's any pain or there's an enlargement, the tummy looks like it's looking big, then the girl would have to be examined.
Should need to be checked, to be examined. Okay, we have Lillian from Oyugis with a question. Good morning, Lillian.
Morning to you.
Yes, good morning. To your question or your comment, Lillian?
Okay, I had a problem. Okay, I had a CS last month on 13th.
You had what?
A CS during giving birth. Okay, nilifanyiwa CS. Na until now kuna kitu imefura tu kwa tumbo kama mawe. So I don't know what's the problem.
When was the CS?
Okay, when was the CS? Lillian, when was this cesarean section?
Okay, the CS was on 13th December.
13th December, last year?
Last year.
Okay. All right, we'll answer your question, Lillian. We'll also take a call from Beth in Nakuru. Good morning, Beth. Hello, good morning, Beth. We're waiting for Beth. Good morning, Beth. Can you hear us?
Can you hear me? I'm listening.
Yes, Beth. Yeah, your question, please. And please turn your TV set off, please.
Okay, so it's already set off.
Sorry?
It's already set off.
Okay, thank you.
Yeah.
Yes, your question?
Okay, now I have not been receiving my period for about 2 months. And then when I went to the doctor, he told me that if I have not done the test,
if you?
Kama sijafanya lalanda ama kufanya chochote, I can be disciplined.
Okay.
Yeah, but now in about 31 days, sasa sijaipata bando na my back is pain.
Okay.
Yeah.
All right. Thank you very much, Beth in Nakuru.
Yeah.
All right. Thank you. Okay. 2 questions there. We have Lillian in Oyugis who has a stomach which she's concerned about, and she had a cesarean section. What concerns should she be having?
Oh yeah, I think she's saying there's something she's feeling that is hard on her tummy, but I think that's just part of the healing process. where the incision, the incision was made, usually below the skin, the tissues take a bit of time to heal. So there might be a bit of hardening. And that is normal. It takes a few months and then it clears.
Okay.
So I wouldn't be worried at all in her case.
So she doesn't need maybe to, how long should she give it maybe for her to feel like she's back to normal?
Okay, by now she should be doing her normal activities. She should be able to eat well, go to the toilet, no issues. So that hardening, probably in the next 2-3 months, it should be completely gone.
Okay, for somebody who's gone through a cesarean section, how long normally does it take for you to actually heal fully?
Usually about 6 weeks.
Okay.
Somebody's back to their usual selves. And so by then we expect somebody to be quite okay.
Okay. All right, we also have Beth in Nakuru who says she's not had her periods for 2 months, 21 days, and she has back pains, and she's also concerned.
Okay. Usually, if a lady's periods delay, the first thing we have to do is do a pregnancy test. And if she's done that and it's negative, then she would usually need to see a doctor to see if she has some hormone problem, which is causing her to miss periods. And usually there would be a few tests which can be done to see if there's a hormone problem. Also, sometimes for some reason, some ladies skip periods and then they come back and everything goes back to normal. So we may need to find out, is she doing exams? Is she traveling? Is there something which is causing a bit of stress? Yeah, it can make the period skip. But so I'll probably ask her to give it 1 more month. If they don't come back, then she needs to be checked. Of course, she should do a pregnancy test even as soon as possible. Okay.
Because I guess, yeah, of course, if she's pregnant, then that would eliminate any fear of why they're not there. It would be evident. Now, back to fibroids. Are they hereditary?
There is a relationship in that those who've had fibroids will have daughters who are likely to get fibroids. So there is this genetic predisposition, though it's not really well understood.
Okay. And then we come to lifestyle. Of course, with the day and age we're living in, there's so much change in our lifestyle, in the food we eat, our exercise regime, the amount of stress that we go through, you know, just in our day-to-day activities. Do fibroids develop out of, or is there a risk factor based on our lifestyle, specifically the food that we eat and the stress factor that we have?
Generally, diet has not been found to be a risk factor, though hormones, sometimes ladies are given hormones for one reason or another, and that can predispose, especially estrogen. In the past, when the contraceptive pills, the family planning pills, had high amounts of estrogen, then that would really predispose to people getting fibroids. But now the amount of estrogen has been reduced to quite a minimum, and so it doesn't now really affect the fibroids. So diet really is not such a big issue nowadays.
Okay. Raf Katu on Twitter is asking if fibroids are genetical or generational. I guess that also ties in into
exactly,
what we had said earlier. Okay. And then the other thing is, are they cancerous?
A very small percentage, almost negligible percentage, can become cancerous. Less than 1%. And even this is disputed, because some people believe that some of the cancers which were thought to arise from the fibroid actually arises from tissue which is not part of the fibroid. So again, ladies should not worry that their fibroids would become cancerous. The risk is extremely rare.
Okay. Are there any factors that would predispose you to have it become cancerous as opposed to not, or it's still not?
No, again, it's just some people who develop it. The symptoms that would make somebody think that it could be cancerous is if the fibroids have been growing slowly. They usually grow quite slowly, and then suddenly they grow very fast. So a lady has had some enlarged, the tummy is a bit enlarged, but then suddenly it grows very fast. Then we'd be a bit suspicious about that.
All right, we have Elizabeth in Nairobi. Good morning, Elizabeth.
Good morning.
Yes, straight to your question.
My problem is I don't have the heavy period. I deal with the problem, the pain, which is not much. My problem is, since I was 39 to now I'm 41, I'm continuing to get very bad gas. On Sunday, I thought my stomach would burst at night. I don't eat. Like now, I've not eaten from Sunday because I'm scared pain and the gas is too much. Just advise me, is it hormones? And if it's hormones, can I be helped? Because I've not worked 2 days now.
All
and
right.
it happens every month.
Every single month?
Every single month. Since I was 39 to now I'm 41.
Okay.
But when I'm 41 is now too bad.
Okay.
Inafura, tumbo inafura, ni kama vitu zinanidunga.
All right.
And Buscopan is not healthy.
Okay. All right, thank you, Elizabeth. We'll also take another call from Ibrahim in Buruburu. Good morning, Ibrahim. Good morning, Ibrahim.
Morning to you. How are you?
Very fine, thank you. What's your question, Ibrahim?
My question is, I would like to know how much does it cost for the fibroid test?
For the fibroid?
Fibroid surgery.
Okay.
Yes.
All right. All right, thank you, Ibrahim.
Thank you too.
Okay, we can start with Elizabeth in Nairobi. She's 41 now. From when she was 39, she's had very painful experiences with her periods, and then the gas issue is what she's concerned about. What could this be?
Yeah, in her case, I would something which causes a lot of gas at times is there could be something with the intestine or the stomach, so it may not even be a gynecological problem, but it would be good to know whether she's saying she doesn't eat, she's not eaten for a few days. With problems of the ovary, some ladies have what we call early satiety, meaning they eat something very small and they feel full. So in her case, I would actually want to investigate the ovaries, still with the same ultrasound. It would be able to tell us whether it's enlarged and whether it looks suspicious. Because again, we have ovarian cancer which can cause such symptoms. And then we'd also see does she have fibroids? Then if the uterus and the ovaries are normal, then now I would probably send her to a specialist who deals more with stomach and intestine issues, gastroenterologist. Yeah, that could be the issue with her. Okay,
can fibroids cause that gas she's talking about? Because she seems to link it to her periods. Maybe it has a period that it comes in linked to the periods.
Yeah. Unless the fibroids are extremely large, because like a pregnancy, like a full-term pregnancy, because now the fibroids would press on the stomach and that could contribute. But in ovarian cancer, what happens is that the cancer spreads to near the stomach and then presses on the stomach, and that's why ladies with ovarian cancer have issues with eating. So that's where, I'm not saying it's the one, but I think it's something worth investigating. And then if everything is okay, then send her to the gastroenterologist.
Okay. Then there is the issue of cost, and we had even alluded to that, because I think this is a major concern for many people, because the minute you hear surgery, normally it may just even stress you, because there is the doctor's cost, there is cost for the hospital. Nowadays, I think you're charged for every single thing that is used during surgery. And of course, this is Ibrahim's concern. I'm assuming that possibly he knows somebody who has fibroids, and he's concerned about the cost. Generally, what would the cost be?
It actually differs from one hospital to another. These are procedures which are done in the government hospitals, and so that would make it quite cheap, or relatively affordable. Also, NHIF would pay some of the amount. In the private hospitals in Nairobi, it would be a bit different. Also, we have mission hospitals like Kijabe Hospital, Chogoria, again and St. Mary's Hospital in Langata. So again, this would make the price differ. So it differs. It can go from as low as 5,000 to 10,000 shillings for everything, all the way to, depending on which hospital, it can go 200,000, 300,000.
And I guess one of the things that really pushes the cost up is the kind of surgery it is. Is it considered minor or major surgery? Is it the kind of surgery that you'd need to go and maybe possibly account for a week where you'd be in hospital? Or is it something that, is it a procedure that can be done and as soon as it's done you can go home?
Okay, usually it's a major procedure, and usually the patient would stay in for 3-4 days in the hospital. It's actually the commonest operation done on a lady apart from cesarean section.
Wow.
The hysterectomy, to remove the uterus. In a young lady who still wants to have children, then we would not remove the uterus, but we would remove the fibroids alone, so that she can have the uterus and still get more children, and we call that myomectomy. So it's slightly different, and though the costs are generally around the same. Yeah. Over the years, in the past, this operation was, especially let's say 100 years ago, it was an operation which was full of complications and mortality. Women would die, but now it has become quite a safe procedure that it's done routinely in almost every other hospital in the country.